Hello everyone, today we are going to discuss about chronic inflammation. Chronic inflammation means it is a response of prolonged duration, that means from weeks or months, in which inflammation, there is tissue injury and also there are attempts of healing. They occur simultaneously in this process. Those three morphological features are very important. That means there is active inflammation, there is tissue destruction, and there is attempts of healing in chronic inflammation. In acute inflammation, the main cell type that involves is neutrophils, but in chronic inflammation, macrophages are the main cell type that involves. So, we can divide chronic inflammation into two parts as granulomatous inflammation and non-granulomatous inflammation. We discuss mainly about granulomatous inflammation here. Granulomatous inflammation means it is a collection of activated macrophages, and also there are T lymphocytes, as well as sometimes it can be associated with central necrosis. What is granulomatous inflammation? There are activated macrophages, there are T lymphocytes, sometimes it can be associated with central necrosis. Again, this granulomatous inflammation can be divided into two types as foreign body granuloma and immune granuloma. In foreign body granuloma, there is no T cell mediated immune response occur. But in immune granuloma, there is T cell mediated immune response can be seen. Usually, this foreign body granuloma or non-immune granuloma occur by inert foreign bodies or non-antigenic stimuli. There are several examples. This foreign body granuloma can be due to exogenous materials as well as endogenous material. Exogenous materials are some examples: suture materials, then fibers, talks. Then endogenous materials are keratin, nail shafts, like that. Let's discuss about immune granuloma. When there is a microbe or self-antigen coming into our body, macrophages activate T cells. Then those activated T cells produce cytokines such as interleukin-2, tumor necrosis factor, interferon gamma. Again, those cytokines activate macrophages. Those activated macrophages can be divided into two as epithelioid histiocytes and multinucleated giant cells. Some examples for immune granuloma are, the causes are, it can be bacterial causes like tuberculosis, leprosy, syphilis, cat scratch disease, then Toxoplasma gondii, then sarcoidosis and Crohn's disease. When there are cytokines, macrophages become activated. When those activated macrophages resemble epithelial cells, we call it as epithelioid histiocytes. When those activated macrophages fused with two or more activated macrophages and become multinucleated cells, we call them as giant cells. There are some specific features of epithelioid histiocytes. Epithelioid histiocytes are usually elongated cells. They have pale eosinophilic granular cytoplasm as well as central ovoid nucleus. Here, multinucleated giant cells again can be divided into three types as Langerhans giant cells, foreign body giant cells, Totten giant cells. Here you can see a granuloma. There are lymphocytes in the periphery, lymphocytes, and there are epithelioid histiocytes as well as multinucleated giant cells. I told you earlier, epithelioid histiocytes are elongated cells which have abundant cytoplasm and central ovoid nucleus. Multinucleated giant cells have more than one nuclei. Here you can see they are giant cells or large cells. And here you can see sometimes there is a necrosis in the center. Here you can see a granuloma, which is a collection of epithelioid histiocytes. Here you can see elongated nuclei are there. And these epithelioid histiocytes have abundant cytoplasm, which is pale and eosinophilic, and surrounded by lymphocytes. This is a granuloma that you can see in tuberculosis. There are four main features in the granuloma in tuberculosis. Those are epithelioid histiocytes, as you can see here, epithelioid histiocytes, first one. Then second one is the Langerhans giant cells, and third one is the peripheral lymphocytes, and fourth one is the central necrosis. You have to remember those specific microscopic features that you can see in tuberculous granuloma. What are those? Epithelioid histiocytes, then Langerhans giant cells, lymphocytes, and central necrosis. Here you can see in these Langerhans giant cells there is a horseshoe-shaped nuclei. Here you can see an example for sarcoidosis. Actually, the sarcoidosis etiology is unknown, but in sarcoidosis you can see there are multiple small discrete granulomas. That means those granulomas are not fused. Here you can see this is a section of lymph node. Sarcoidosis in lymph node. Actually, sarcoidosis can be occur in lung, lymph nodes, skin, salivary glands, as well as in the liver. So this is a section of sarcoidosis in lymph nodes, not in the skin. Because of a lymph node, you can see there are lymphocytes. Here you can see peripheral lymphocytes. If it is a sarcoidosis in the skin or lung, you cannot see this much of lymphocytes in the periphery. Because of this is a lymph node, you can see there are lymphocytes in the periphery. Two main points that you have to remember in sarcoidosis are the granulomas are multiple discrete small granulomas. That means granulomas are not fused and the lymphocytes are very few. But in tuberculosis, there are peripheral lymphocytes are more. I showed previous picture, and the granuloma is formed by fusing more granulomas. That means it is multiple confluent granulomas you can see in tuberculosis. Here, this is a section of the skin. You can see this part is the keratin layer, then the epidermis and dermis is there. Then granuloma can be seen in tuberculoid leprosy, not in lepromatous leprosy. In tuberculoid leprosy, granulomas can be seen in dermis and cutaneous nerves. Here you can see the granulomas. Here is a comparison of granulomas in tuberculosis and sarcoidosis. In tuberculosis, you see multiple confluent granulomas or fused granulomas, but in sarcoidosis, multiple discrete granulomas or not fused granulomas. In tuberculosis, you have peripheral lymphocytes are more, but in sarcoidosis, very small amount of peripheral lymphocytes are there. In tuberculosis, additionally, you can see caseous necrosis in the center and Langerhans giant cells. Another thing that you have to remember, what is caseous necrosis? Caseous necrosis means it is eosinophilic granular amorphous debris. Caseous necrosis means eosinophilic granular amorphous debris. You have to remember that as well. So that's all about chronic inflammation. Thank you for watching.